I think this is important, and I don't know how much you guys actually get in your curriculum, in your health class or in your drug class about date rape drugs. And date rape drugs are not just for used on people that are out on dates. They're used to commit crimes all the time, and it's not just on dates. So they're called club drugs because they're mostly used in clubs and bars, but private residences as well. And this little pie chart shows you that 30% in a pub, another 21% in a club. So over 50% of the drugs were used in those settings. But you still have business premises, 11% in a business, 10% in a private house, private parties, 12%, wine bars, and in other locations. So date rape drug is any drug that's used in a sexual assault. So it's called drug-facilitated sexual assault. And you'll hear people say DFSA. That's what that is. And I put that in yellow because just everybody knows. Yes means yes. It does not mean, maybe, just because they didn't say no, that meant yes. No, yes, absolutely means yes. And you don't get confirmation, you don't get permission, then it's a no. These drugs can quickly affect their victims. And I want to tell you about the most common ones that we've seen. Rohypnol, and I'll show you some of the street names, known as roofies. GHB, gamma hydroxybutyric acid, ketamine, and alcohol. Absolutely, alcohol is probably the most frequently used date rape drug. So Rohypnol, what does it look like? It comes in a lot of different forms. These light green pills, sometimes you'll see them blue, and sometimes the inside of the green pills have blue in them. Sometimes they're just white pills. There's no smell or taste. These are street names for them. If you ever hear these names out there, they got a lot of different street names. I'm sure Joe's got some other ones. What are the effects? It can be as quickly as 30 minutes, can last 8 hours. 1 milligram can affect you for 8 to 12 hours. Causes muscle relaxation, a drunk feeling, problems talking, nausea, dizziness, sometimes problems seeing, confusion, and can lead to death. GHB. So between Columbus and Cincinnati, we've had a few cases of GHB used in a very large scale. So there were some bartenders that were working with some guys that wanted to commit crimes, wanted to have dates and do things to their dates, whether they were girls or boys, without their permission. So they colluded with a couple of bartenders. Bartenders got the GHB, which is just a clear liquid, lined the glass with it, let it dry. And if you're in a bar or a club, it's dark. It's really dark. You can't see that. I mean, you can't see if it's cloudy or if it has something. And then, when they would come up, they would have a signal. They would have some little symbol that they would give each other and say, oh, this is the one I'm interested in. But they had some sort of a, hand sign. And the bartender would reach for that glass, take it down, pour the drink in there. And of course, the victim is watching, and brand new bottle opened up, poured it in the glass. I'm safe, I'm good, drinks, and then, no. And then they're drugged, and then they leave the premises. So fortunately, we had some agents that were involved that recognized, that gotten some tips, and were able to apprehend these bartenders and these guys and arrest them. But it's out there, you have to be careful. These are the street names for GHB. There are a lot more than this, but you'll hear some of these out there. GHB can work as quickly as 10 minutes. And I mean 10 minutes, really, really fast. And it can last 3 to 4 hours. And it's not detectable in urine after 6 to 12 hours. If you're a victim of being drugged with GHB and you don't get help within that immediate time period, we may not be able to find the drug in your urine. And then we may not be able to apprehend the criminal. It's very potent. It's made in labs. It can slow your breathing. It can cause coma. It can cause seizures. This is a list of things that we've seen with GHB, which looks very similar to what we were talking about with Rohypnol. Ketamine's another one. Ketamine is seen in veterinary hospitals and is mostly used for that, but it's also used in hospitals. It's clear liquid again. may or may not have any taste or smell. These are the different names for ketamine out there. Very fast acting, and it can last 1 to 2 hours. It's a short period of time, but the victim may be aware of what's happening to them while it's happening, but they can't do anything about it. Can you imagine somebody being assaulted, knowing they're being assaulted, but they can't physically do anything about it? And that can happen with ketamine. It's really important to get help as soon as you can. These are all the different effects of ketamine. Alcohol. So alcohol has been used to commit sexual assault. People lose their ability to make proper judgments. You've heard of somebody called an angry drunk. You have chatty people. It increases your confidence. Some people become more emotionally unstable. The club drug ecstasy, that's another one that's being used. So most importantly, if you suspect you have been exposed to a date rape drug or been sexually assaulted, it's really important to get a friend to take you to the emergency room or call 911, get taken to an emergency room. We ask, do not pee, do not wash your hands, do not change your clothes, and do not bathe, because then you wash off all the evidence. You wash off all the evidence that we need to apprehend the people that perpetrate these crimes. And no matter how much you drank or what drugs you took or didn't know you took, sexual assault is never, ever your fault. And it's really common to go through a lot of different emotions. So, definitely get help.